Hello everyone, my name is Dr. Dolly. I am a medical doctor with over 7 years of experience. I want to share some stats with you today. Do you know that in Nigeria of today, one person is diagnosed with diabetes in every 2 minutes? Over 700 people are diagnosed with diabetes every day. Let's go down to high blood pressure. High blood pressure puts 1 in 4 Nigerians at risk every day. Around 9 out of 10 Nigerians are unaware that they have high blood pressure. What about cancer? 10 Nigerians die every hour due to cancer. 240 Nigerians die every day due to cancer. In Nigeria, over 102,000 cases of cancer occur every day. How about obesity? 1 in 4 adults in Nigeria are obese. 1 in 10 children in Nigeria are obese by the time they get to the age of 4. So, what is the purpose of this? The purpose of this is for you to take care of your health, live healthy, and avoid all these diseases because they are actually lifestyle costs. Thank you.
Hi, good evening, everyone. Welcome to another fresh episode of your Billion Dollar Buddy. With me today here is the senior dealer of Salad Masters, Madam Sharon.
Everyone, it's great to be back, and I look forward to listening and answering any questions and sharing my own personal story with you. Thank you so much.
Okay, and another yet an important guest is our nutritionist in the house, Folashade. Hi, Fola. Can you hear me?
Yes.
Okay, it seems like there's a little glitch with her. So, welcome to another fresh episode of breast cancer awareness. As we all know from what we did yesterday. Okay, Fola, can you hear me now?
Yes,
Hello?
I can. I can.
Yeah,
Yes, I
please say
can
hello
hear
to our
you.
viewers. All right.
Good evening, everyone. Welcome to today's show. I look forward to sharing more tips on nutrition with you. Thank you.
Thank you so much. Okay, so like we did yesterday, we had an in-depth discussion on breast awareness. Yesterday, I'm going to give a brief summary for those people who were not opportune to be on the program yesterday. Yesterday, we kicked off with the Breast Cancer Awareness Month, saying that October, the month of October, is the month in which is dedicated to make breast awareness known to the general public. And we talked about how the pink ribbon became the symbol for breast cancer. And after that, we also said that we discussed on how to lower your own personal risk of getting breast cancer. We talked about the use of regular exercise, healthy diet, limiting alcohol intake, and then if you happen to be on medications like hormone replacement therapy and birth control pills, you need your doctor's advice on the side effects of such. Now, another one is also breastfeeding. Women are advised to breastfeed their children if they can. But if they can't, they should also seek their doctor's advice on how to do it well. But breastfeeding is one of the ways in which you can prevent breast cancer. We also looked at common symptoms of breast cancer. Now, we said that if there's any change in the size or the shape of the breast, that it's an alarming symptom. You should also see your doctor. If there's any pain on the breast itself or on the armpits, you should also see a doctor. Then if there's nipple discharge, even if the discharge is watery, milky, blackish, brownish, or bloody, it's a good sign to let your doctor know. Another one is also breast lump. Like Madam Sharon shared with us today, her mother's own started with a breast lump, and that's how they now found out that she had cancer. So if you had any of these symptoms or any of the symptoms I didn't mention, but they are around the breast that you haven't seen it before, that is a new occurrence, you just have to let your doctor know. Another one also is we also did dietary prevention of cancers, in particular breast cancer. We dealt with it in depth with our nutritionist, even giving us a pictorial examples of what she meant. It was really a refreshing show yesterday. So today we are here today, and today's own, we have so much today. We're continuing on breast cancer awareness, and in today's awareness show, we are going to be dealing with causes of breast cancer, complications of breast cancer. Especially, we will deal more on screening and diagnosis of breast cancer, what you need to do to get screened, and then breast self-examination, the regular examination you need to do on yourself to find out if there are some abnormal breast lumps, breast masses, and then you go to your doctor for the professional one. But every woman is encouraged, especially in this month, to be aware of this breast examination. So we're here for you today. Let me start with today's introduction. Increased risk of breast cancer with family history is known. 20 to 25% of women are diagnosed with breast cancer. They have the family history of breast cancer, especially if you have first-degree relatives like your mother, your sister, or daughter who were diagnosed with breast cancer. You already know that you have 20 to 25% chance of developing it. That is still why we are here to make people aware that breast cancer is really a disease that we should all be aware of. The fact that it's not happening to you right now, but it happens to your relative, puts you at risk. And that is why we are bringing this program to you, to let you know how you can lower your own chances of getting it, even though your family members has it, and then how to prevent it with your lifestyle and what you eat. The other one is the actual risk that family history conveys depends on one, the number of relatives that have it. That also determines, the more number of your relatives that have breast cancer, the more it is that you're going to develop it. Now, the age at diagnosis. If someone's mother was diagnosed with breast cancer at the age of let's say less than 50, let's just say 45, that's kind of early, and that increases the chances of the offspring getting it too, or even earlier. Another one is, like I said, having a first-degree relative with pre-menopausal breast cancer symptoms. Now, that shows that there is a very increased risk for the person to have it. Another one is also one or more first-degree relatives has it. This one, it says that the risk increases to 4 to 6 times if you have more, like you have mom and sister coming down with breast cancer. That further increases your chances, unlike the person whose mom only has it and no other relative has it. The person with mom and sister coming down with breast cancer will likely develop cancer 4 to 6 times more than the person who doesn't have it. Now, second degree relatives like your aunts, your grandmother, the risk is reduced. You will have the risk of developing breast cancer in 1.5 chances of developing breast cancer. Now, we have women who are at higher risk of developing breast cancer. One, they are those people with personal history of breast cancer. They've had it in one breast before, they might likely have it again. Or women who have therapeutic radiation to the breast area, whatever the cause. Maybe you had chest problems and they had radiation around that chest area, it increases the chances. Like I said before, BRCA is a gene that most people possess. And if you possess this gene and it's positive, the woman might run a higher risk of also coming down with breast cancer. Women with a family history, like I say, first degree relatives, and then women with biopsy diagnosis of atypical ductal hyperplasia. Those are the women that will likely come down with it. Now, I'm coming to the screening. Screening. If I have symptoms in my breasts, if I have symptoms in my breast, maybe like I have a pain around my armpit area, or I have a breast lump, or there's abnormal nipple discharge, what do I do? Good. If noticing the symptom is one step, then taking it a step further, when you notice this thing, you don't sit back at home. No. What you do is you go further for screening. And now we have three components of screening. We have first the genetic screening, breast cancer screening, and what we call cancer prevention. And we are also going to dwell on cancer prevention because this program is all about prevention. Because, like we always say, in this program, prevention is better than cure. Now, the genetic screening. Genetic screening is now said to be in breast cancer that is most common malignancy in patients with, there's a sickness we call Lee-Fruman syndrome. Now, people with this syndrome have 90% chances of coming down with breast cancer. And then when we do the screening, we are screening for P53 gene. It's getting too technical, but that is all it is. So when you go to the hospital, actually, this is our problem. But a woman should know, whenever they are getting screened, you should ask your doctor, my BRCA1 and 2 genes, am I positive for that? You should know. Women who are carrying these mutations have a lifetime risk of developing breast cancer, up to 70 to 80%. Lifetime risk means that they can develop it at any age. At any age, they can develop it. Now, if you have BRCA1 abnormally elevated, you have lifetime risk of coming down with breast cancer plus ovarian cancer, colon cancer, and prostate cancers. Prostate is in men, and like I say, men also come down with cancers. And also the gene, also BRCA2, if you have it, this is more in men. The men who are positive for this gene, they develop male breast cancer, pancreatic cancer, and for the women, they come down with ovarian cancer. So when you're getting screened, these are the genes we screen for, and then we now know whether these genes are present in you. And if it is, there's a different kind of medication that is given that blocks the reception for these genes and then provides healing solution for the patient. Now, the personal history of breast cancer of the person who has positive BRCA1 and 2 is as follows. When you're diagnosed at the age of 45 years or younger, or diagnosed at the age of 50 years or greater, now this now further decreases your chances of I don't know how to put it. It now decreases your chances of getting treatments. If you don't get treatment early at this stage, yes, if you don't get treatment early at this stage, it is very bad. So the best thing is to get it very early. So now it is advised for genetic screening to be done for relatives who already, people who have relatives that are down with cancer. Don't wait until that person is down with cancer to now say, okay, this is the time that we are going to test it until she starts developing symptoms. No, don't do that. Now, when you're diagnosed, you also go for this genetic screen when 2 or more close blood relatives have breast cancer, pancreatic cancer, or prostate cancer at any age. In this case, you find out that children of such families are going to be screened at the age of 5. Yes, at the age of 5. Now, you also have close male blood relative are also screened, and then personal history is also gotten. Now, they should start breast awareness starting at the age of 18 for people with such families. But if the close relative, more than first degree close relative, more than like 2 already has it, the person just goes for screening at years earlier than 18. Then it is advised also for the person to have annual clinical or self breast examination starting at the age of 25. That's early. And then you also have annual, that's yearly mammography or magnetic resonance imaging. Now, and then you have self breast examination after the age of 35. So after the age of 35, every year you do breast examination on yourself. And for the breast examination, I wanted to bring out a dummy to demonstrate it here, but the dummy wasn't available. So I had it on a slide, and I'm hoping that during the time for self breast examination, the diagrams comes up so that it becomes better understood that way. Now, also, we also have what we call annual pelvic examinations and transvaginal sonography. Sonography simply means ultrasound. They should be checked annually because a person might not develop breast cancer but can develop ovarian cancer. So now, if we are doing annual pelvic examination with transvaginal sonography, it can be picked. And once there's an ovarian cancer, that raises you to the raises an alarm. Then you now start checking the breast and the chest region for any malignant growth around there. Then for such women in that family, once they are aged 35 to 40, a risk reducing ovarectomy. That's what we mean that by you can now have what we call surgeries that will now remove both breast and even ovaries to prevent such occurrences in the babies. Now, at this point, I think I'll take a break and call in Folashade to give us still, because what we are now saying here is like pretty alarming. So we now want to tell them on how to use nutrition to curb these things, because breast cancer is really a burden. Once it comes from the screening to the treatment to the chemotherapy, radiotherapy, everything is a burden on the psyche. So please, Ola, can you just do a step down for us on the dietary prevention of breast cancer at this point? Thank you.
All right, thank you, Dr. Dolly, for for what you've been sharing so far. And so, when it comes to nutrition and cancer, nutrition plays a great role in the prevention and also in the management of cancer. And like I mentioned yesterday, I gave general about 5 tips that we can get to use to lower our risk of having breast cancer. And so in managing breast cancer, once you've had it, nutrition also has a great role. It is a very vital component of managing breast cancer. And so one of the things you need to know is that nutrition, the major goal of nutrition, once you have the breast cancer, you want to begin your treatment, is to help people with breast cancer to keep a healthy weight. Is very, very important. And also research has shown that many people get to add weight in contrast to what we know of people who have some other type of cancer, where a lot of people get to lose their weight. For in breast cancer cases, we find people who also tend to gain weight, and research has shown that increased weight even increases the poor diagnosis, the poor treatment outcome. So we need to ensure that the nutrition is helping them to maintain a healthy body weight and also to maintain strength. A lot of time, due to the treatment option, the therapies, sometimes clients come down with weakness, with fatigue, loss of appetite. And so it's very important that the nutrition at this point also addresses some of the side effects of the treatment that comes into play. And overall, nutrition is to help. Once a treatment option is already been assigned, it could be radiotherapy, could be surgery, could be any of this therapy that would be used for the treatment of the person with breast cancer. before the surgery, if it, for example, if it's surgery, before the surgery, we need to ensure that we optimize such person's nutrition so that we can get to aid healing and also prevent some of the side effects of the treatment during and after that. And so that is one reason why nutrition is so very important. And so I'll be just sharing generally a few nutrition guidelines. Number one is that we need to increase the fruits, vegetables, and the whole grain intake. And for a patient, for example, who is not able to consume, maybe due to loss of appetite, not able to chew, not able to consume due to tiredness, and so many of the side effects that may come up, it is very important that we find ways to modify such person's meal. If that person can chew, for example, and just too weak to do that, we could always convert and modify such person's food into fluid form, but then still ensuring that the patient gets the right nutrition to heal, to boost healing, and also to help reduce the growth of the cancer. We also need to ensure that we're increasing the intake of smoked and cured meat. I mentioned the issue of red meat yesterday, and also ensuring if the person is someone who takes a lot of alcohol, we need to really bring that down. We need to bring it down. And so it's important that one of the key people you would need to work with is a registered dietitian who will help you undergo nutrition screening, just like you undergo every other type of screening when you want to do your treatment. It is very necessary that we also put you through a nutrition screening to determine what your nutritional status is at that time. And so once your nutritional screening is done, a comprehensive nutritional assessment is done, your weight is gotten, every other thing that needs to be known, is determined, then the dietitian can help work with you to create a smart, personalized nutrition plan to help you go through the process of treatment and even post the treatment that you're going through, so that you can the treatment outcomes can be verified. And I think I want to mention at this point that you need to be conscious. A lot of time you find people doing, while they're going through the treatment, they also come in using herbal multivitamins. So you need to be very careful at the point of combining herbs and multivitamin supplements with the drugs that you are using for treatment. And even some of the natural foods that we have mentioned that they are superfoods, you also need to be careful with. For example, if you're undergoing surgery, you don't want to do overdose of garlic, which can increase your risk of bleeding. So all these things are things that registered dietitian will help you look at and determine which or what foods are best for you to go through that period of treatment, and also the how you can get to heal better post the treatment. And so I would like to share a few. Yesterday, I was very excited about sharing some of the cancer fighting foods that we have. And so we have so many of them that you can get to use to either during your treatment or even to prevent breast cancer. And so the first breast cancer fighters, as I have named them. Number one, we have what we call the carotenoids. We have different types of carotenoid. We have the carotene, beta carotene. We have the lutein. There's so many of them, and so we find those carotenoids. They are found in fruits and vegetables, ranging in different colors. You have the dark yellow, the red, all those colorful fruits. And so the more colorful your nutrition, your meals can be, the better, the healthier it is for you. And so carotenoids have been shown to help reduce they help to inhibit the growth of cancer, and also they have the anti-cancer. So for people who haven't had the cancer, they can help you really lower the risk of getting cancer. And then when you have for foods that contain carotenoid, one of the way you can make carotenoids more available is when you cook them. But then you cook on you don't cook on high temperature, you cook on a very low temperature, just so that you don't get to destroy this powerful nutrient that can help you lower your risk. And so we have so many examples of fruit here. I have a couple that I've shared here. We have the tomatoes, we have the mango. These are basic foods that we find around us every day. The tomatoes, we use tomatoes to cook every time. Mango isn't in season now, but then we have mangoes around us. Carrot is in season. You have all this, you can see they are so colorful. Even the broccoli, the guava, the watermelon, you find all these things around us. And so you have the beets, you have the bell pepper. We see these things every time. Sometimes we use them to cook, but if we can get to understand the powerful effect they can have in helping us reduce, lower risk of breast cancer, then we need to, find ways to add them to our diet. Another powerful cancer fighter that I have is also is called isocyanide. And so research has shown that this also has chemopreventive effect. It helps to inhibit the growth of cancer cell. And then this is found in so many cruciferous vegetables. We have, for example, examples of cruciferous vegetables that we have. We have the Brussels sprouts, we have the kale, we have mustard, we have red cabbage, we have the green cabbage. We have all these things around us. You make your salad every day with, cabbage, you use the carrot. All these things are combination of fruits that can really help you while to lower your risk. We also have another cancer fighter called the polyphenols. We have different types of polyphenols, and this is also fun. I remember yesterday that Dr. Dolly mentioned that green tea is also very good, and so we also have a type of polyphenol that is found in green tea, and so this also has been shown to have great antioxidant property and anti-inflammatory properties, and also anti-cancer properties. And then you find a lot of it in I mentioned green tea, in soya beans, in flaxseed. You find them in whole grain series, and this is why it is very important that you consume whole grains. The moment you take you refine the whole grains, and then you take the chaff out, then you're already reducing or taking out those nutrients or compounds that can help you lower your risk of developing cancer. And so the next that we have is the organosulfide, and this is found mostly in garlic and garlic family. So you have the onions, you have the you have leek, you have shallot, you have what we call the garlic. We use that. And so I want to say about garlic that garlic is one of the very powerful foods that we have, and then it has great cancer prevention properties. And one of the best ways for you to get the most of garlic is for you to crush garlic before you consume garlic. Once you crush garlic before you consume garlic, it helps to activate the active compound that helps you to lower your risk of cancer. And so we also have high fiber foods. High fiber foods, it has been shown, research has shown that soluble fiber can really help you to lower your risk of having breast cancer. And so fiber, you find a lot of fiber in fruits and vegetables. You find it in oatmeal, you find it in lentils, nuts, beans. All these are common foods that we have around us, really. So I think it's about making conscious effort to consume this food, cooking them in the right way such that we don't overcook or destroy the nutrients that we have in them. And so some of the other superfoods that we can get to eat to lower our cancer risk, we have the avocado, the oily fish, you have the olive oil, fermented products which contain the probiotics. They help to boost your immunity, and in doing that, it helps to get to lower your risk for cancer. We also have turmeric. The list are numerous. I can't just share everything here, and so we have them commonly around us. I just want to encourage that we make conscious effort. Look at all those food I have mentioned. We have them around us. Add them, be creative, make your meals creative, make them colorful, add all these things, and then remember to cook them, using a healthy cooking system so that you don't destroy the nutrients that you have in them. And this way you will get to, have all the benefits to prevent, the breast cancer, and also heal through the process of the treatment. Back to you, Dr. Dolly.
Okay, thank you so much for that, Shade. That was very in-depth. So anybody now who is afraid of breast cancer, I hope by what she has shown and shared with us this evening that your fears are really going to be like elevated reduced a whole lot, because me too, I learned a whole new things that she has been telling us about. Somebody like me that doesn't like onions, now we know that onions can really help us, and so many other things. So nature is packed full with things that we can use to keep ourselves from all these lifestyle diseases, especially breast cancer, because this is a month dedicated to it. Now, let's continue. I am going to talk about general breast cancer screening guidelines. Now, let me take it this way. I'll go by the age groups. The ages between 20 and 39 years, it is advised that women between these ages should do breast cancer screening once every 3 years. Ages between 40 to 44, women should have the opportunity to begin annual screening between the ages to 44. That is, in this age bracket, you do 40, you do screening annually. That is every year. Every woman who's hit 40 should be doing annual screening. Now, women who are 45 to 54 should do annual screening every 6 months. Women who are 55 to 64 should do annual screening every 3 years. Women who are 65 to 74 should do annual screening every
Hi, Dr.
6 months.
Dolly. You've gone on mute. You've gone on mute, Dr. Dolly. We haven't heard you on the streaming.
Oh my God.
Yeah, we've gone on mute.
Okay.
Yeah, yeah.
All right.
By the
So
way,
no problem.
Dr.
We
Dolly,
recap.
happy
You can
birthday.
hear me now?
Happy birthday. We can hear you. Happy birthday, by the way.
Thank
Happy
you.
birthday.
Thank you.
Yeah.
Thank
Okay.
you so much. So please, can you move the slide to breast cancer screening guidelines? That is where I am so that they can follow me now. Okay, so we're talking about breast cancer screening guidelines. Now I'll divide it according to age. Women who are aged between 20 to 39 years of age are advised to do breast cancer screening every 3 years. Women who are 40 to 44 should do annual breast cancer screening, which is yearly. Do it yearly. Now, women who are 45 to 54 should now do it every 6 months. 6 months because breast cancer usually comes up in women at the age of 50. So if we start at the age of 45 to aggressively check for it, by the time the woman is 50, we will catch any breast cancer that wants to develop anywhere. That's why at the age of 45 to 54, the screening is increased up to 5 years old, up to 6 months now. Now, women who are 55 and above now should have screenings, maybe like 2 year screenings of breast cancer. Because why? The breast cancer now, it's we're no more so alarmed because the median age is 50 years. And these women, if you keep screening them every two biannually, you will definitely catch the cancer before it gets so bad. So the screen, I'm way above the screen. The screen should come to the breast screening investigations. This is a case scenario, usually for we work with that in the hospital. This was the three components of breast screening I talked about earlier. We have the genetic screening, the breast screening, and then cancer prevention. Okay, we go further. Yes, we keep going. This is the genetic screening. What you see there is just a depiction of the DNA. Yes, we keep going until we come to breast screening investigations. These are the genes, breast screening investigations. Yes. Yes, this is breast screening. Yes. No, further down, this is ahead. This is exactly is where I am. Now, you see the breast screening investigations. First of all, we advise to do self breast examination. You are the only one that will examine your breast and know that what I'm feeling now is a lump that wasn't there before. Again, what I'm feeling now is a breast mass that wasn't there before. So that is what you do. It's like we're having a little power challenge, but it has been restored. Thank God for that. Now again, you have clinical breast examination. When you examine yourself at home and notice an abnormality, either there's pain in one part of the breast, or there's a breast lump or breast mass, or there's a discoloration of the breast of the skin, or there's nipple discharge. What you do is that you go to the hospital. The hospital now or the health professional you meet now goes the second step of doing clinical breast examination. Now, this is professionally done so that they will now know whether what you found out to be an abnormality in your breast is actually something to be worried about. Now, if this clinical breast examination yields a positive result, you now go another step further and do a mammogram. there's a machine that is used to do that. So when you now go for a mammogram, they will now tell you the kind of breast density that you have, whether you have a high breast density or light breast density. And it is said that high breast density, it is what usually causes it is a very high risk. If you have it, you might likely come down with breast cancer, but it's only a mammogram that determines that. So women now who have bigger breasts, it doesn't mean that you have higher breast mass. It's only a mammogram that can determine that. So now another breast screening investigation is digital versus screen film mammography. Now this is for professionals. When you get to the hospital, this will be done to you. Now, another one is MRI. MRI is now the test that you now do to further now check all the lymph nodes in the chest area. Are they affected? Is this cancer, is it spreading to the vertebral bone in the chest? This is now what you use to screen the surrounding areas and know how this breast cancer is spreading, what organs it's now encroaching into, and what organs it has spread. Because knowing all these things will play a role in how you treat the patients. And the last but not the least is now the ultrasound screening, where we screen the women, their all parts of the body that can be ultrasound and see whether there is any kind of infiltration into those organs. Now, what we see here is the difference between a breast examination and a clinical examination. Like I said before, the clinical examination is the examination by your left side, done by a medical personnel, or a healthcare professional to detect any abnormalities or warning signs in the breast. But while the breast examination is the one that you do yourself, which we are going to learn how to do now in the next slide. Now, self breast examination steps. Number one is, if you're a lady and you are at home and you have reached the age of 35, you are advised to do this thing. I'm going to teach you this self breast examination. You are advised to do this in front of your mirror at least once every 6 months to know that nothing is going to catch you unawares. So the first thing you do is to stand naked in front of the mirror. When you stand before the mirror, look at both breasts with your two arms by the sides. Check both breasts for anything unusual, anything at all. Pick it. If it's not there before and you notice it, pick it. Anything maybe like nipple distraction. What we call nipple distraction is instead of the nipple pointing forwards, it's pointing either upwards or downwards. That is not how it's supposed to be. If you see this thing, it is something that you should be concerned about. Another one is if the breast is red in color. Red, maybe like looking like something was hit on that area or something, and there was no trauma and the breast is red, is also a warning sign. Another one is puckering and dimpling. Puckering is if you see the skin of an orange, it is puckered, it has holes inside it. That's not how the breast skin is supposed to be. So when you see that, you know that there's a problem. And then scaling, of course, we know what scaling is, something that is dry and the skin now starts scaling up. If you look at something like that and see it on the breast, you should also inform your doctor. Now, the last but not the least is just look for the nipple discharge. If you don't, at this point, you're just examining yourself, using your eye to check for abnormality. You are not going to touch. Now, another step now is when you put your hand. Next is press your hands firmly on your hips and lean slightly towards the mirror as you pull your shoulders and elbow forward. Shoulders and elbow forward, like you're slouching forwards a little bit, then with a squeezing or hugging motion. Then look for any change in the normal shape of your breasts. If there's any change, note it and then alert your doctor as well. Now, this time around, the hands is no more on your hips, but above your head. Look in the mirror, raise your arms and rest your hands behind your head. This allows you to see the underside of your breast as well as your armpits. Next slide. Now, this time around, you bring your hands down from above your head and then place your left hand on your wrists. Place your left hand on your waist and then roll your shoulder forwards and reach into the underarm area and check for enlarged lymph nodes. Lymph nodes are just like circular something you feel. You feel maybe when you have an inflammation, you feel there are nodes there that are bigger than normal. Any lump that you didn't notice before that were there, please check. And then you do the same for both breasts. Again, rise your left hand now, rise your left arm, use the pads, not the tip, the pad of your 3 or 4 fingers of the right hand to examine the left breast. Use 3 levels of pressure, light, medium, and firm, while moving in circular motion around the breast. Beginning at the outer edge of the breast, use the flat part of your fingers, moving your hands in circles slowly around the breast to detect any lump or mass, which either it can be superficial or deep. If you do this well, you are bound to see any abnormal mass that is there. Now, gradually make smaller and smaller circles until you go towards the nipple, and then check behind the nipple as well. Now, the last but not the least is lie flat on your back with your arm overhead and a pillow or a folded towel under your left arm. Lie flat on your back. And when you lie flat, place an arm over your head and then get a pillow or a folded towel and place it under the left breast, and then repeat the circular motion again, starting from the outside until you get towards the breast area, and then check. Now, these are what is checked when you're examining a patient. You check for the breasts. Both breasts, are they the same side? Are they symmetrical? Is one up and one down? All these are pointers that something is not right. The shape of the breasts must be the same. Skin color, lumps, skin tethering, all of that, you should be aware of it. There's an appearance we call pull the range. Pull the range means that the skin of the breast is looking like an orange skin. When you look at it, you know that this is not normal. This is not how the breast was designed to be, and you are advised to raise an alarm at that stage. Now, another one is the nipples. Now, are they everted, flat, or inverted? All of that is important that you note that. Are they cracking, or is there something like an eczema on the skin of the breast? You should know that. Now, is there gross deviation of the nipple, or is there any bleeding or discharge from the nipple? Now, as you look at the nipple, you look at the areola. Areola is the place surrounding the nipple. You now observe for abnormal reddening or thickening. That is that for breast examination. These other ones that you see the diagrams here are basically clinical stuff when the health professional is doing their professional breast exam. Now, we move to another form of screening, the screening mammography. Now, breast cancer screening is performed in asymptomatic women. Asymptomatic means women who don't have breast cancer or women who don't have any symptom indicating that they have breast cancer, because it's in this asymptomatic stage that the disease can be detected early. Diseases like breast cancer, you do not wait for it to develop before you start doing something about it. Here, the emphasis is on prevention. So it goes further to tell us when the mammogram was discovered in the 1950s and all. For women at high risk, annual screening may be started at an early age. Like I said, there's a way that you feel that breast cancer is so much in this family. What you will do, you start the screening very early. At 18, the patient is already going for by yearly checks, mammogram screens and all of that, so that if there's any indication, you just remove the breast before it causes problems for the patient. Now, apart from the mammogram, we do what we call MRI screen. MRI screen. The slide should go to MRI screening. Yes, here. Now, MRI is also a machine that's, like I said before, MRI screen, once you are to do an MRI screen, it's usually recommended for women who are, at least you should be 30 years old for you to have an MRI screen. And then you should really have a strong family history of breast cancer. Now, routine use of MRI screening for the general public is not recommended, no, because MRI screening is very expensive and it can have also high false positive rates if you keep repeating it and repeating it like that. Now, MRI, there's a research done and it was concluded that MRI is more sensitive than mammogram. Of course, that's why it is more expensive. It is more sensitive than mammogram in detecting tumors in women at high risk for the familial breast cancer. Now, we move on to ultrasound screening. Ultrasound screening is a complementary tool to mammography for the diagnosis of breast cancer. Why do we do it? Because women who also have breast cancer may also come down with ovarian cancer. And then also, you can also do ultrasound on the breast itself. So it complements the results that is produced by the mammogram. So it is recommended that ultrasound for women presenting with a dominant mass or asymmetric thickening or nodularity should be done. So the role of screening ultrasound remains controversial. Not many people want this. Now, like I always say, we are so particular here about prevention. We cannot do but not prevent. So we have done dietary prevention of breast cancer. And now I said it yesterday, I'm also emphasizing it again today. Modify the risk factors for breast cancer. If you modify the risk factors, the chances of you getting the risk factor decreases. The first modification is limit or reduce alcohol consumption. Maintain an ideal weight and exercise on a regular schedule or on a regular basis. Then there are several drugs in which you can use to prevent breast cancer too. But the type of drug in which you're given needs to be discussed extensively with your caregiver, that is your doctor or your healthcare professional. Now we go to prophylactic surgery. Prophylactic surgery, that's the title. Good. This is it. If you all know the face of the woman here, this is Angelina Jolie, a popular actress in America. Why her face came up here is because why? She had a strong family history of breast cancer. Notwithstanding her fame and because she's in the limelight, but she did what we call bilateral total mastectomy. That is, she prophylactically removed both breasts so that she doesn't come down with what is it called, breast cancer, because she has a strong family history. Mother, all of them, they had the strong family history in their family of coming down with breast cancer. So she didn't want to come down with it because she has experienced the pain, the suffering, the trauma that breast cancer brings to people who suffer it, not just them, but their family members. So she went ahead and removed both breasts before she even starts having symptoms. And because she did it, she's still alive today and breast cancer free. So women should not be afraid to have that kind of surgeries, removal of two breasts, if that is the suggestion by your doctor. Because for a doctor to suggest that, which means that the woman is at a very high risk. There are so many newer and screening technologies which we some of them are still on the experimental level, but it's worthy to be mentioned. Number one here is full field digital mammography. Another one is digital breast tomosynthesis, molecular breast imaging, and abbreviated fast MRI. So that is that for screening and diagnosis. Here, it is a case scenario of a woman who is 46-year-old who presented to the hospital asking them breast cancer. So she informs that she had a 15-year-old friend who was diagnosed with cancer the previous month, and she worried herself about getting it. So on further inquiry, she also gives history that she delivered her only child when she was 32 years of age, and she had no breast history, family history of breast cancer. So she does not perform breast examination and has never had a mammogram done at 35. So she was now asking her doctor about advice on breast cancer screenings. So that is it. So I know that, or I am positive that we took a lot from today's show, because the thing is about prevention. That is what the emphasis was all about. That is what the nutritionist talked about. That is what we're talking about, because screening is for women who is not yet down with breast cancer. So when you catch it at that stage, you know what to do. Screening, especially for women who have family history of that. So at this stage, I would like to invite our senior Madam Sharon, who I share the same birthday with today, to give us her own work experience on breast cancer, because she has a first-degree relative who has breast cancer.
Hi guys, Sharon, are you there? Your sound is off. Follow Shadi, we can see you looking very busy. Yeah, are you there? Yeah, great. So
Hello.
Sharon, can we hear you? Now we have Sharon. It's her birthday today. We have Dr. Dolly. It's her birthday today. So listen, this is a special show. We've taken time out on their birthday. So what I'd like to do is I'd like to sing happy birthday to them. And can we just send them a message of happy birthday? I'm going to say happy birthday to you.
To you.
Happy birthday to you. Happy birthday, Sharon and Dr.
Mr.
Dolly.
Dolly.
Happy birthday to you. Hip hip, hooray!
Hooray!
Hooray.
Hey, all right, I'm gonna leave over to you. I'm gonna get out of here now. Over to you.
Okay. Yes, thank you, Dr. Dolly. That's been really so informative. And I've been listening attentively. And as I shared yesterday, my mother was diagnosed with breast cancer about 10 years ago. And everything that you have said, I had to go through it myself and do my own research. So we are really privileged at this stage in society to have all the information that helps us to prevent, to look at our lifestyle in terms of eating. And also, one thing that I wanted to ask you, Dr. Dolly, was that when somebody's detected a lump or some abnormality in their breast,
Yes.
then what is the time scale for all of the processes that you have talked about? Because fortunately, I was in the UK, and everything happened so quickly from the time that my mother noticed a lump in her breast, to taking her to the GP, to then going to the hospital, then having the screening and having the MRI. It happened very fast. So I'd like to know from you, in Nigeria today, what's the time scale, and how realistically is it likely to happen quickly with all the processes that's involved?
Okay, thank you for your questions. Well, in Nigeria, there are so many processes in screening and diagnosis of breast cancer that it takes like four months, because I know that I have a colleague who had breast cancer, and
Okay.
before the diagnosis was so much. We screened. After the screening, we had to do biopsy and then send the biopsy and sample to laboratories in Nigeria. Then they told us that they had to send it first of all to South Africa and then to
Wow.
England.
Wow.
Yes. So now, before you collect all the results together, a whole lot of time is being wasted. This is for people who are in Lekki. Now, not to talk of a woman who's in the rural area, before you now do this thing, send it to Lagos. Lagos will forward it to South Africa, and then forward it to the UK for confirmation of what the histology of the biopsy says. It takes a whole lot of time. And then for some people, it is further complicated because of the finances involved. These investigations are not cheap. Like when I said MRI, you don't get it cheap. So by the time they raise the fund to come back, they're wasting a whole lot of time. And if the breast cancer happens to be in the aggressive type, it will be spreading at the time you're wasting getting the diagnosis done. So now these are one of the problems that we see in Nigeria and then in countries also who are facing similar challenges to deal with it, to raise awareness for the general public to know. It is not until it happens to you directly that you know that people who are suffering this kind of diseases in countries like ours are undergoing a whole lot. Madam Sharon, I must commend you. You were lucky. You were where the health system is better, and so
Yeah.
the thing was a bit speedy. Over here, it's really not that fast.
Okay. So
Yeah.
yeah, I'd like to also just add that whilst you've given such a fantastic kind of knowledge about what we should do, so I'm giving you an example of what happened to me when my mum was diagnosed with breast cancer. Now, the person who has been diagnosed is often not in the right frame of mind to take everything in. So it's just
Exactly.
equally important to have that support network, whether it be a daughter or an auntie
That's
or a
right.
niece, to know and support the person who has had that. Because I know with my mum, she was in a late 60s, early 70s, that when she was diagnosed with it, she couldn't comprehend the impact of what was being said to her. So it's
Wow.
equally as important for the support network to be strong and be aware with all the information that you've given out today. It would be great if we could have some kind of, and I know that we can speak to Mr. Tony Bello about having a package or something that we can follow through, that this is stage 1, stage 2, stage 3 that you should do. And albeit that we're in Nigeria and it takes time, there's nothing stopping us from raising awareness ourselves and actually doing a
That's
lot
right.
more to impact the policies that we don't have here.
That's right. Thank you, Mom. Thank you.
You're welcome.
That advice is well taken, and we hope to do something. And also, this program is also our own little contribution in raising that awareness, in making sensitizing the people to let them know that this and this is what we're lacking, and we need to work more to strengthen that aspect of our healthcare system. Thank you very
Yeah.
much, Mom. Yeah.
One last thing, sorry, because
Okay.
I've been through it. One of the things that I guess we could actually cover in from a health perspective in the future is
Okay.
about the husbands, the partners of the
Yeah.
women who are diagnosed with this type of cancer, and where they fit in and how they also can help, because it's equally as important to involve
That's right.
the other side of your relationship, whether it be a partner, a husband, to be aware of how they too can help this process.
Yes,
Yeah.
yes, you raised a very valid point. You raised a very valid point because women at that state of mind, the last thing they will want is for their partners to be giving them any kind of trouble. They need their partners at that stage to be very supportive. Anything short of that is not it at all.
Yeah.
It will not it will, because for you to be like healthy, you need to be psychologically all right for even the medications you are being given to work, because at that point when you're diagnosed of cancer, you're being bombarded with a whole lot at the same time.
Yes.
So
Yes.
your partners, family members, and friends, even well wishers, need to be as supportive as they can.
Absolutely. Yeah. Yeah. Okay. Thank you.
All right. Okay. So, Mr. Tony, the ball is in your court now.
Oh, hi. Wow, wow. You know what? This subject is amazing. It's something that I'm not familiar with, obviously, but it's helpful. And I'm sure my wife has listened to it partly, and I'm sure she's going to listen to the whole show. But I'd like to say thank you very much. It's been amazing. And I thank you very much, Dr. Dolly, for the medical advice and the prevention. I thank you very much for Shade, for the nutrition, because now, as we say, prevention is better than cure. And even when you have it, at least taking care of yourself is important. And I'd like to say thank you for our senior dealer, Sharon, for actually just taking time out to share her experience with her mum having it, because I think that is invaluable experience. So thank you very much. And I also thank you for the show, Your $1 Billion Body Show by Dr. Dolly. Thank you for the show, and thank you for the sponsors, Salad Master and the Excel region, for actually giving the time to make breast cancer awareness a great awareness thing. So thank you also for that. And I've got some messages in the scene that just came in. Some people just come in. They just want just a summary of it. Someone just come in and said, "I've just come in. I've just seen this show." But it's we're just about wrapping up now. But I'm hoping. There's a question that came in, which is, please, how do we prevent? How do we prevent? And I think obviously, I don't want to say too much about that, because Dr. Dolly, you've already said that, but maybe you can just say to them just a small summary in 1 or 2 sentences, and then they can probably watch the video. Yeah.
Okay. So, like we said, the whole show is about prevention, prevention, prevention. We had a very good run yesterday about prevention, and then today again. Okay, so let me just do a recap. First of all, for you to prevent something, you need to know what causes it and then prevent it. It's basically lifestyle modification. Firstly, I would like to tackle on the limit or eliminate alcohol consumption. That is key. Then women who are just delivered, breastfeed your children if you can. If you have a family history of cancer, make it a duty to go for screenings. Don't wait until it creeps up on you for you to start action. Another one also is about nutrition. I like Falashado gave us in-depth review on how you can use nutrition to prevent cancers generally, especially in this case, breast cancer. Also, then you need to live a very active life, maintain an ideal body weight, live active, don't lazy around, because in such conditions, people who are obese have a higher chance in cases of cancer than people who are not. So if you can just do these things, if you didn't take anything away, just know that have regular exercising, that's well, and then again, reduce or limit alcohol consumption, cigarettes, and then for women who can breastfeed, please, they should do that. And if you have a family history breast cancer, it's a point to always screen yourself so that it doesn't catch you unawares.
Thank you very much. And Folashade, do you want to say just a couple of a sentence on how you prevent from a dietitian and nutritionist point of view?
All right, thank you, Mr. Tony. And so I mentioned that it's very important that you invest in your nutrition. I shared earlier, I think once you're able to watch the video again, you see some of the food you can get to add to your diet. And I made emphasis on the fact that the cooking system is also very important, because a lot of times, sometimes we eat these foods, but then we overcook them and then destroy the nutrients it's supposed to offer health value, to us. So it's very important that we also do not cook food on high heat. We get to eat some of them raw. We get that, and we don't, going through the proper cooking system, we're able to ensure that the nutrients are intact, and so that way it's very important. And I mentioned that once you have it, also you need to speak with a registered dietitian or a professional nutritionist that can guide you to create a personalized plan to ensure that your nutrition is quite for during the treatment and even post the treatment is top notch, and then it's able to help you through the process.
Thank you very much, Roshan.
Yeah.
And Sharon, your experience with your mum, what could you give us in terms of prevention from your mum's point of view? Yeah.
Yes, well, what I said yesterday has just been confirmed through Dr. Dolly's information about prevention and eating the right type of food. And actually, back then, 10 years ago, we were almost told to eat raw because you shouldn't overheat. And now, fortunately enough, we're in a business where we can actually cook our food that retains a high level of vitamins and nutrients. So we're at an advantage. And I do believe that whatever we do in life, whatever we are wanting of good health, all boils down to how we prepare and cook our foods and how that ultimately allows us to have better health, even having been diagnosed. And I remember my mom, when the consultant was saying to her, you have to cut down on so many things. You have to take more vegetables, more fruit, and not eat red meat. And she was horrified. She was absolutely horrified. But I now understand the depths of why that was being said, because prevention is so better than cure.
Thank you very much. And Dr. Dolly, final words from you?
Yes. Like we said, also always on this show, prevention is better than cure. And also,
we're having a reception problem from Dr. Dolly. Slight reception problem. Voice is slight reception.
So, their food as their medicine.
We didn't hear that one, Dr. Dolly. Dr. Dolly, we didn't hear. You said something about food as something.
Yes. We want the viewers to eat their food as their medicine.
Wow.
Eat your food like it is medicine and turn your kitchen into your clinic.
Wow. From a doctor, that is powerful. That is powerful. Try to turn your food into medicine and turn your kitchen into a clinic. Thank you very much, Dr. Dolly. And again, thank you very much to our sponsors, Salad Master and the Excel region in Lagos, Nigeria, and all the dealers in Lagos and Nigeria. Thank you very much for the host, Dr. Dolly, and also for the nutritionist, for Shade, and also for Sharon. Thank you very much. And we're going to leave you with a short video. The short video is anybody that likes the Salad Master machine, watch this video. If you want to prevent and hopefully reverse some lifestyle diseases, watch this last video. So on this night, good night from me, Dr. Dolly.
Good night, everyone.
And everyone, good night.
Good night. Yes, thank you.
Bye.